Make sure they invest in that regularly throughout their lives. And
AI most promise, I believe, within biotech over
like agentic workflows. So there's going to be lots of tools and things called agents. And
AI is a bit like electricity.
You should be using them as much as possible.
Using AI to diagnose asthma and other.
With Tony Sedgwick, Pam Koom, Andy Craig.
well, no, but in order to benefit from tech, you didn't need to invest in Microsoft, Apple, whatever. You just needed to own a big global stock market. So if you owned the world equity market or the US stock market, you would have benefited from tech directly from owning the tech companies, but also because all the other companies like airlines and restaurants, whatever, are all using tech. And so it's the same with biotech. So what I am comfortable saying is that big picture, all somebody needs to do to have exposure to this is to own a big global equity fund and make sure they invest in that regularly throughout their lives. And that's kind of, I think that's true of whenever you think about investment at all, but you will benefit from the value created by biotech if you do that.
Markus Gershater.
the opportunity there for biotech to become a really massive and impactful force for humanity. I mean, AI is an absolutely massive concept, right? And it actually encompasses so many different things which are hugely diverse, right? So to talk about it all in one lump is always quite challenging. However, there are, very clear advances. So if we think about LLMs in the space, that's probably the area which has been most clear to people on a day-to-day basis about how much they're impacting our lives. And similarly, that impacts biology in biotech in the same way. Biology is such a complex system. It's not really human understandable in a lot of its features, right? It's not something which you will naturally be able to intuitively think about a lot of the time. So of all disciplines, AI has the most promise, I believe, within biotech over and above everywhere else. That's my own personal opinion.
A lot of smoke and mirrors. What do you see?
This is Joel.
so AI works as an assistant. So maybe your kids will be even smarter now than they would have been 10 years ago because they have effectively like Einstein in their pocket all the time to ask them queries and questions. So I would adopt ChatGPT, for instance, start using that straight away, and there's more and more of these tools coming out and they're just going to make people smarter and smarter. Like every generation before, things come out, the computer, the calculator, the internet, all these things have just made people smarter and have to do less laborious tasks. How you can maybe integrate these tools. I'm seeing more of these things called like agentic workflows. So there's going to be lots of tools and things called agents, and they're effectively you're going to have interfaces to be able to deploy technology easily, to do automated tasks. You're going to see them more and more on your phones. So I would learn how to use these tools. And also maybe it's good to have a bit of knowledge of coding because otherwise you're always going to be restricted to the people who make you the tools. But if you understand a little bit how to do these, you can in theory have a language model write you a piece of code and then you can stitch code together, but you can't stitch the code together unless you understand the syntax. But you don't have to be an expert, you just need to know enough to be able to stick it together. So AI agents they use a language model. So language model is the base and the language model understands the kind of what the user wants to do. And then everyone who's used a ChatGPT interface will know that they have to put information into the kind of context window before they run the query. So giving the language model the right information at the right time means it gives a better answer and it is less likely going to hallucinate. So there's a big thing at the moment where these language models are getting smaller and smaller and smaller, and more people are focusing on doing the first bit, which is giving it the right information at the right time. So given a query, it could be like, what does this thing mean? The language model understands the query relevant to the context, it finds the information, pulls it in, provides you an answer, and then the agent would then say, what would you like me to do next? So I would like to book a holiday to Slovenia, and then there's a bunch of steps to do that, and the language model would be, the agent will be built specifically for that goal, and would provide an output which would be hopefully booking the task. But then those agents can communicate to each other.
So here we go.
Thanks, thank you. Awesome.
Health company, what have you? So
Nadia. She's a trade advisor to the Danish embassy here in London.
Fantastic time to be evolving in this intersection between AI and life sciences, for sure. I have studied AI as well as a scientist. AI is a bit like electricity. If you connect up your operations to electricity, then you have the power to push it forward. And I think power of AI is that it can digest information quicker, particularly valuable for biological sciences.
Tom Lazenby And he's the founder of an interesting company, call to action for such an individual, for such a kid, you know.
You should be using them as much as possible.
Okay.
My personal advice, just mainly because children are curious and they're always wanting to ask questions, and now they have like almost an imaginary friend that has a lot of good answers that they can talk to again and again and again.
In their natural language. Yeah.
In their natural language. So, you know, be curious and just keep asking those questions, because the more we learn faster at a younger age, the faster like new technologies and the growth of knowledge in the human race, I guess, is going to expand massively, I think.
Hi.
Victor Higgs. He started a company.
We're working on improving the diagnosis of respiratory disease like asthma. There's about 100 million people undiagnosed with COPD. So what we looked at doing is using breath analysis. But what we've done uniquely is we developed a point-of-care breath test, a device that's easy to use, carable. You just breathe into it, and think of this like an alcohol test, but much more sensitive. And we collect the biomarkers, chemicals of disease in your breath, and we analyze that using AI to diagnose asthma and other respiratory diseases, and tell you that you might be having an asthma attack up to 3 to 4 days ahead. Our objective is to stop people from having asthma attacks and save lives.
Thank you.
Thank you.
Thank you, Victor.
Okay.